Compulsive sexual behavior is sometimes called hypersexuality or hypersexuality disorder or even sexual addiction. I think sexual addiction is probably the most common media term for it. It's an overwhelming preoccupation with sexual fantasies or sexual urges or sexual behaviors that are almost impossible to control. They're compulsive, essentially compulsions. In most cases, these urges, I mean, they cause distress, anxiety, stress, and have a negative impact on health. And they can impact all parts of life, like jobs, careers, relationships, basically every single area of life. And when these sexual behaviors become a major focus, and become impossible to control and are disruptive or harmful to not just the sufferer, but also to the people around the sufferer, then they can be considered compulsive sexual behavior. Let me put the symptoms on the screen so you can pause the video and take a look at them. It's difficult to tell what causes compulsive sexual behavior, but it could be an imbalance of chemicals in the brain, such as serotonin or dopamine or norepinephrine. It could also be an addiction, and like all addictions, this causes changes in the brain circuitry. And again, like all addictions, you need more and more of the addicted element to feel satisfaction. An alcoholic has higher and higher tolerance for alcohol. A drug addict has higher tolerance for drugs. Sexual addiction is no different. There's a higher and higher tolerance and a higher need in order to get the satisfaction that you got, the first few times. Of course, there is also the indication, at least some indication anyway, that certain diseases or conditions can cause compulsive sexual behavior, epilepsy and dementia being two, because these can cause damage to part of the brain that affects sexual behavior. Now, it's treated with medications like mood stabilizers and antidepressants, for example, and psychotherapy, which is very important element of managing it and keeping it under control and allowing you to manage an effective day-to-day life. The best person to diagnose it and determine the best course of treatment would be a psychiatrist. Whatever you do, do not self diagnose this simply because you have a high libido. This is a this is a destructive condition. And it's no laughing matter. It really isn't. People giggle about it and go, oh, they're a sex addict or they're addicted. I mean, like any addiction, this is not funny.